I'm going to stay here, let you take the reins. If you need me, holler out. And once you get going, give me a thumbs up. That way I can go and take a shower. Yes, no, it is. Relax. So at 10. This mic is so good, we won't pick up outside conversation. You couldn't even hear me talking. So, then you remember where the power switch is here? So green,
Recording in progress.
it should come on.
Hey, Dr. Miura, are you ready?
Yes.
Okay, I'm gonna have Donna comes up and then we start, okay?
Okay.
Welcome, everyone. Thank you so much for joining us for today's webinar. My name is Donna Chow, and I'm your host and moderator for today's class by eLotus, your leading provider of TCM education. We have been hosting educational courses for over 2 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of continuing education. Today's webinar is 10 practical expert-approved formula strategies for all herbalists with Dr. Kyle Miura. There will be one break today, and we're set to end today's class at 2 p.m. So if you guys need to download your lecture notes, you can go ahead and find them on the Blue Course Access page in your eLotus account. To use the webinar chat room, set your chat preference to everyone so that everyone can see what you're typing and be part of the conversation. And to ask Dr. Miura a question, go ahead and enter your question directly into the Q&A box. And finally, the quiz and video replay. The quiz and video replay will be available for you guys tomorrow afternoon, and I'll send an email out when that's ready. Today's speaker is Dr. Kyle Miura, and he will talk about the top evergreen formulas that are very popular among his patients. This webinar is perfect for new practitioners, acupuncturists who didn't learn about herbs in school, and anyone who loves to learn. You can find more information about the formulas that Dr. Miura will be sharing in the clinical manual. I'll send the link to you guys in just a bit. All right, let's go ahead and start today's class. Dr. Miura, will you please take over and share your PowerPoint?
Can everyone hear me?
Yes,
Okay.
loud and clear.
Okay. Thank you, everyone, and welcome. Thank you for giving up part of your Friday morning to listen to my short class. Usually Friday in our clinic is extremely busy, so I understand all of you. So thank you. So let's begin. Okay, I'm just getting okay, I apologize. I'm so used to teaching in the classroom. The last 3 years, I've been so busy in our clinic over the pandemic. We've been treating people all over the world for COVID and long COVID. But first of all, I would like to acknowledge Doctors John Chen and Tina Chen. They are an amazing duo of herbalists who have been my friends and mentors from the beginning. I have always been inspired by their wisdom and their kindness. So this webinar is pretty much dedicated to both of them, and my gratitude to both of them. And to Donna Chow, who has been doing this for many, many years. I'm so humbled to be teaching with so many masters. So today you'll just get a snippet of some of my knowledge and experience. And I also like to recognize Jonathan Pang, who works with me, is our clinic manager. He put all the slides together after I typed them up. Okay, so first slide. How do herbal formulas influence successful patient outcomes? Again, my paradigm is bringing the best of the West and the best of the East together. And so one is biochemical shifts within the body. Two, extended therapeutic effects of acupuncture sessions. So I tell my patients that acupuncture plus herbs is 1 + 1 = 3. So you get so much out of herbs when it's combined with acupuncture. And third, patients want to see symptom relief. And I would say that's the main criteria for them to return because they know something has shifted in their body in a positive direction. So approaches to formulation. Most of the collection formulas come from traditional applications, classical formulations, but modified for today's problems and diseases. And that's the ingenuity of Doctors John Chen and Tina Chen in bringing this to our profession. So we have contemporary applications, and I like to use the word stacking. And I'll explain more about that in the later slides. how we combine formulas to address root and branch. So third, understanding TCM pathologies from a Western perspective. And again, this is the what I love about Evergreen is that you can look at on a chart the Western diagnosis and look at the different TCM pathologies that we can address. And fourth, understanding other contributing factors that can influence recovery. That could be from sleep to pharmaceutical drugs to even in the home, mold, for example. So that's a little overview. And then the 10 formulas that I chose were in 4 different groups. 1, stress, anxiety, sleep. 2, depression. 3, flu, COVID infections, and 4, lungs and cough. And I know this is only a snippet of all the collection formulas, but I chose this based on our last 3 years with the COVID pandemic primarily has really affected our world. So this is the overview of the collection formulas that I will discuss today. And these are some of the how I try to educate my patients. Because many of you could say many patients are very smart, with our internet now, they can research their diseases. Sometimes I tell them they're smarter than me, smarter than the doctors. So we can learn so much from our patients as well, but we just have to keep our knowledge up to par. So I talk with my patients about biochemical shifts in the body. Number 1, inflammation. So much of research has shown that almost 90% of our current contemporary diseases have roots in inflammation, infections, and we'll talk about goose syndrome, which I did not learn in acupuncture school. I had to learn later in my career. So one thing about herbs is that they extend the therapeutic effects of acupuncture, reducing pain, helping relaxation. And if you remember, when the body is relaxed, the parasympathetic nervous system will be turned on, and most healing happens when the parasympathetic nervous system is turned on. And third, I've noticed that many of my patients, if they do not get good sleep, then many of their symptoms get worse in the day. And sometimes it doesn't matter if they miss their herbs. The sleep is such a crucial aspect of healing. And third will be symptom relief. Okay, I like to sort of begin, my teaching today with a quote from Siddhartha Gautama, known as the Buddha. And I mention this because I truly believe that Qi follows intention, or Qi follows the Shen, the spirit of the heart. this is truly how we guide qi to our patients and to one another and to ourselves. So the Buddha once said, teach the triple truth to all, a generous heart, kind speech, and a life devoted to service and compassion. This is my mantra and why I became an acupuncturist, to bring healing and to make the world really a better place. So this is, you could say, Herbs 101. Even this is something that patients can understand and over time appreciate, because I think we live in a very drug-driven society, especially in the United States. So I like to educate my patients on comparisons between herbs and drugs. I try to emphasize that herbs are safe, they're natural, they're often slow acting, but they're working deeply at the root, almost no side effects. And sometimes the amount seems larger than a drug. And then we have drugs. As we know, drugs have many side effects, short-term and long-term. They're made in the laboratory. They're not bad, but they're not fully natural. Often fast-acting on the body, usually on the branch. And usually a drug comes in a very tiny pill. Sometimes my patients might grumble, oh, we have to take so many capsules or herbs, but I try to tell them that the capsules is a contemporary way, making it easier for them to take the herbs. But I would tell them in the ancient days, we would make them into a big soup. So I can make it in the soup. We can get it in the soup for you, or we can keep it in the capsules. I would say 90% of my patients would say, keep it in capsules. And that always makes me smile because it's easy for them and easy for us to dispense. Especially, our society is quite on the go and the capsules are quite convenient. Let's move on. Okay, this is taken from basically the first pages of Evergreen Herbs. Evergreen's promise to all of us and to our patients is authenticity, potency, purity, and safety. And these four promises are very critical for myself as a practitioner and for my patients. And what Doctors John Chen and Tina Chen make sure that all the herbs that are that come from Evergreen are authentic, have high potency, have the highest purity and the highest safety, and they use the most contemporary pharmacological techniques and machines to make sure that they keep this promise. And I usually hand my patients in their first session a brochure of Evergreen, assuring them of these promises. And that's important for many patients because sometimes the media, um, downplays herbs, or even Western doctors would downplay herbs that they may be dangerous. And this will reassure my patients that they are not. So, okay, I'm still on evergreen because this is very important. Again, I talked about evergreen herbs are inspired by both Doctors John and Tina Chen and their teachers, bringing together ancient formulations and contemporary and modifying them for contemporary needs. Because Dr. Chen is a pharmacologist, a pharmacist, everything is guided at the highest standard for CGMP, FDA, and World Health Organization standards. And I share that with my patients. That's very important, again, to assure them of safety. Third is evergreen herbs are eco-sensitive and they respect the biodiversity and sustainability of our planet. So that means there is a respect for endangered species, making sure that the herbs come from farms that respect our planet. And this means a lot to me and to, I would say, all my patients, especially because of global warming and what's affecting us today. We talked about this, enhanced and modified formulations to treat contemporary ailments. And last, what I really appreciate about evergreen herbs is that they are devoted to us, the practitioners. So patients cannot go on eBay or Amazon and purchase evergreen herbs. They have to be given to the patients by the prescribing acupuncturist. Most herbal companies do not do this. And in my opinion, I find it disrespectful to us because herbs are medicines and they need the expertise of the practitioner. And when our patients know that they cannot just buy the herbs anywhere in Whole Foods or online, they know that the herbs have a pharmaceutical level and that they're in many ways true medicine, equal on par with pharmaceutical drugs. So next, again, finally, what Doctors John and Tina Chen, they've written an amazing text called Clinical Manual of Oriental Medicine, and it's specifically written for us practitioners. And I find it unique because Dr. John Chen is educated in both Western and Eastern medicine. There are charts in that text that you can look through and find like a Western diagnosis and see the different potential TCM diagnosis attached to it. This is important because most of your patients would have gone to their Western MD and given a Western diagnosis, And that will be the starting point in many ways of our assessment from them from a TCM point of view. And another aspect of this text is they have included a part, all the texts, all the herbs will show potential drug interactions with herbs and what to avoid. Yeah. And third, we'll talk about more this later, is how we can combine different collection formulas together for best results. This is something that I did not learn in acupuncture school about combining many or different formulas together. Usually it will be one formula and then we'll add a few single herbs. But because of the purity and potency of evergreen herbs, especially the collection formulas, sometimes I can combine up to even 10 formulas for a chronic disease like Alzheimer's or Parkinson's or end-stage cancer with amazing results. Next is each collection formula has a recommendations of dietary and nutritional aspects that we can educate our patients with. Some come recommendations from Dr. Mao Xing Ni, and that's a good resource to share with our patients. And also each collection formula comes with point recommendations from the traditional points, ear points, and master tune points. Okay. So as you know, part of my background is public health, and also I'm, you know, as a healer and a practitioner, we always want to look at what's going on in our world and how are we going to adjust to those issues going on in the world. So as I mentioned before, we are still in the post-COVID pandemic, still more mutations coming in and spreading. And with that is our global warming and environmental disasters, from the fires in California, the floodings in Florida, all coming in an ecosystem that is not balanced. And that's when I try to assure my patients that that even if we can try to change our internal harmony with herbs and acupuncture, we are working to, in many ways, to try to reverse this imbalance in our environment. And so you'll notice in the background, I have a lot of plants and aquarium in my clinic. The plants are vibrant. We have fountains. We make sure that our clinic is exquisite like nature. And that's when I remember when I taught TCM theory to my students, my first question I would ask in the exam is who is the teacher of our medicine? I would say different answers, you know, multiple choice, the client, the teacher, the author of the Tao Te Ching, or else said nature. Well, anyway, nature is the answer. This is where our medicine comes from. And part of that is really appreciating nature and letting the harmony of nature really take root in our own bodies as practitioner and in our clinic space. So anyway, next is wars and gun violence and crime. We have seen an increase of this in our world and in our country. And so with that comes quite a bit of disharmony, especially in the Shen. And we're going through an unstable global economy causing much anxiety all over. So anyway, as I reflected on our situation from a public health perspective, and if some of you have studied the 5 elements and have read the ancient texts, the texts begin with the wood element because the wood element governs the movement of all qi in our universe, in our world, in our bodies. And I tell my patients, I tell myself, if qi does not move harmoniously, it's going to stagnate and cause all kinds of problems. So the wood element, this is again, TCM Theory 101. One major function of the wood element is detoxification. And we are seeing that a lot in long COVID. Clearing heat, inflammation, this goes hand in hand with global warming. And I tell my patients, we are a microcosm of the macrocosm. When the world is inflamed, our bodies become inflamed. But if we try to de-inflame our body, we are also working to de-inflame also our world in small and practical ways. So the major function of the wood element is to move qi and blood and clear stagnation. So as you remember, Xiaoyao-san is free and easy. How can all of us and our patients move free and easy with happiness and lightness in our own lives and in our patients' lives? Let me see. Many of my patients, when they leave a treatment, they'll tell me they feel so light, or they'll feel tingling around their bodies, or they feel like a burden has lifted. These are signs, confirmations to us, that we've done a great job in facilitating healing. The wood element also is important for immune and emotional modulation. As you remember from TCM Theory 101, the liver organ is the most sensitive organ in our body. So we need to take extra care of our liver, gallbladder, wood element. And what I have been accessing more often in the last 3 years is the extraordinary vessels and the ghost points. And we'll talk about that more later. So next, we're shifting to the Western side. I know knowledge seems infinite, and yet most of your patients will come in with at least one pharmacological drug, and they might ask you, how can herbs work with the drug or the drugs that I'm taking, or they might even ask you how best that I can wean off the herbs, the drugs. But we'll talk about that more later because we need to work with their doctors primarily to do that. Again, what I have found in my practice is that at least 50% of my patient population is taking at least one pharmaceutical drug. And I have a significant geriatric population, and I would say 80% or more of my patients are on at least one pharmaceutical drug. So this area, again, working with evergreen herbs is to me critical because of herb and drug interactions. I've placed some resources here. Some of you may not know of this one resource. It's a monthly subscription called Worst Pills, Best Pills. And these articles come out once a month, and they are recent research publications written by Western doctors, Western pharmacists that really give a great assessment on the pros and cons of drugs. Another resource is the FDA and CDC websites, and also drugs.com. Okay, so the goals of acupuncture and herbal treatment today is regulating and moving liver qi and blood, enhancing wei qi, our immune system, calming shen, our heart spirit, and the hun, the liver spirit. And what I have found recently is, anyway, there has been quite a number of disharmony in the Shaoyin and the Shaoyang, the heart, kidney, and the gallbladder, Sanjiao, and also nourishing qi and blood. So quite a number of cases of exhaustion and chronic fatigue. So moving on, common acupuncture interventional strategies. I would, this is a summary of what I do in our clinic. I was grateful to be trained by several masters in the bloodletting technique when I was in my doctoral program. One of them was a direct disciple of Master Tung. And I've modified it for safety in our clinic. And I have been using this specific technique more often than not because of our situation today with inflammation and goose syndrome and chronic and autoimmune diseases. Even when someone is qi and blood deficient, you will find some aspect of qi and blood stasis and heat stuck mainly in, I would say, the upper jaw. So I did not learn this in basic acupuncture school in the master's program, but I use a simple diabetic lancet and a nice jade stone gua sha and glass cups. And I usually scrape around DO 14, UB 13 and 17, the shoe points of the lung and the blood. And I make sure everything anyway is sanitized. And that is Clinic 101 that you've learned. But that will be, I would say, a whole different class. I also use infrared heat and medical laser in our practice. As you know, both of these contemporary instruments help with microcirculation. That again, the medical laser would be a separate class and how to use that. I use gentle electrostim on kidney and spleen. This is just some examples: kidney 3, spleen 6, and UB 20 to 24. Just traditional points to move qi and blood, basic acupuncture 101, 4 gates, large intestine 4, and liver 3, liver 2, UB 17, 18, spleen 10, move blood. Traditional points to tonify qi, spleen 6, 3 and meeting, spleen 9, to lift the qi, clear damp, lung 5, tie-in point, clear phlegm, resolve phlegm, stomach 36, nourishing blood and qi, Ren 4 through 6. Yeah. So as we begin, the first group of herbs I'm going to cover is the stress, psychological, and sleep cluster of the collection formulas. And just to note, just about a week ago, CNN poll of, I believe, almost 3,000 individuals in the US found that 90% of US adults say that mental health is in a crisis today here in the US. So again, confirming what's going on in our country and in our world today. The 3 formulas that address the liver primarily to move qi, move blood, is calm, calm ES, and calm ZZZ. And 3 of these formulas spread liver qi. They're, I'm sorry, spelling error, adaptogenic. So they have an adaptogenic function, which I'll explain more. Basically, their function is to bring the body back to some form of homeostasis. And as we remember in Western biology, when the body is in homeostasis, that is almost the ideal state of the body when optimal healing can occur. And all these formulas also nourish qi and blood and clear heat. I'm gonna go and check to see if I have any questions. Oh, okay. So one question is, do you teach bloodletting through eLotus? And I have not, but maybe one day that was one question. Usually I have an apprentice in my office because it's really hands-on and requires sanitation and making sure everything's clean. Let me see if there's any other question. Okay, one question. Can you use calm for migraines? If not, what formulas? And I have many of my patients on the calm series with outstanding stressors. So grateful for evergreen formulas. Yeah, I will go into that in more detail uh, on my headaches and migraines. But actually, um, I did not include those evergreen herbs has two um, very specific formulas for headaches. They're called Cori Dallin CR for chronic and Cori Dallin AC for acute. Um, those two formulas can be stacked with any of the calm formulas or combined for headaches. But that will be a little more, that will be probably another course. Okay, before we enter into the three calm formulas, I want to give you something unique that I do for my patients. Is that I add an adaptogenic herb to the formulas, and they're single herbs. So the definition of and specifically an adaptogenic herb is they sweep up harmful stress hormones, primarily cortisol. And the dangers of high cortisol, which I have been seeing in all my patients, has been extremely high because of the stress going on in our country and world today. We know from Western medicine that high cortisol is primarily stored in the adipose tissue. And when they're stored there, they can stay in our bodies, causing inflammation, a lower immunity, weight gain, sleep issues, infertility, headaches, irritable bowel syndromes, anxiety, depression, blood pressure issues, erectile dysfunction, brain fog, and on and on. And maybe I'll give you an example. I've been helping a teacher trying to get pregnant, and she is in a very high stress job with all the instability, through the pandemic with as a teacher, and she has polycystic ovarian disease and some endometriosis. So a lot of obstacles in helping her to become fertile. She exhausted the Western route, but I'm glad that she went through that route to do her best on that end to become fertile. So she reached out to me for help. I did many of the evergreen formulas, and then nothing was quite working until I added in one of these adaptogen herbs to clear cortisol, and then she got pregnant. So it reminded me how one hormone in our body, cortisol, can almost block Qi. So next slide. So there are mainly 5 adaptogenic herbs that research has found. And these are some of the single adaptogenic herbs that I add to the evergreen formulas for my patients. And if you study these adaptogenic herbs, it's very interesting that they all grow in very harsh environments. And these herbs have adapted to these extremely harsh environments and survive and thrive. So the energy and the potency of these herbs in helping us um, in sweeping up cortisol and or adrenaline or the other harmful hormones that build up in our bodies from stress. These herbs are extremely powerful that I've found. All these herbs, well, first we'll begin with ashwagandha. Its nickname is Indian ginseng. It's not a CAL or a NCCAOM herb that's required, I believe. But it is the only one of the 5 that is a calm Shen herb. I did not put that in the slide, but you can write that in. It is warming, it boosts the qi and increases oxygen in the body. And because it's a calm Shen herb, it is amazing in helping people to sleep. And sometimes patients would ask me, oh, why would it help me to sleep when it helps to boost my qi? Wouldn't it be something like coffee and keep me awake? And so I have to explain to them that sleep requires qi. So we need enough qi to sleep, but the Shen also needs to relax. So anyway, ashwagandha, an amazing herb, Indian ginseng, calm Shen. The next one is holy or tulsi basil. In India, they call it the queen herb. This has been one of my favorite adaptogens because they also resolve phlegm and they open the lungs, almost perfect for long COVID and lung issues. And if you remember from the ancient text, phlegm is said to be the root cause of all the strange diseases. So strange diseases would be like the autoimmune diseases, cancer, long COVID, Lyme disease, all the mental health, psychiatric diseases. And that happens to be my specialty, the chronic and complex diseases. You need patience and understanding with yourself and with your patients when addressing these complex diseases. The third is maca. Its nickname is Peruvian ginseng. It's primarily known to naturally boost the libido and fertility, boost the qi. This is a wonderful substitute for Viagra. But I would tell my patients this is long-term and Anyway, this is an amazing herb adaptogen. The fourth one is rhodiola. You can note in your slide, this is the only cooling herb of the five. And its Scandinavian name comes from Scandinavia region called golden root. And it's primarily known to help the brain, brain fog, mental fatigue, and also boost the qi. And the fifth one is eleuthero or Siberian ginseng, boosts the qi and the wei qi, our immune system. So anyway, those five I do add commonly to the evergreen formulas, and they make an amazing difference. And lastly, what I do add, because of the times we're living in, lots of sleep issues. I believe I read one report recently, Western report, that the number one issue patients going in to their Western doctors is sleep issues. And again, as I mentioned, my patients would tell me if they don't get good sleep, their symptoms return. So I use CBD in our clinic. But I have found, which has not been shown yet in research, but I see it clinically, that CBD works in the opposite direction if one has goose syndrome. So for example, CBD is meant to relax and sedate, but if one has a syndrome called goose syndrome, the CBD would actually stimulate and cause one not to sleep or to get more nervous. And that's when you try to avoid CBD for the patient. This syndrome I did not learn in the basic my acupuncture program. I learned it later. Basically, Gu stands for possession. In the ancient times, the doctors could not. They used a language that are not that familiar to us today, but possession of evil spirits. But when you work with goose syndrome, in many ways, that's how sometimes you will feel as a practitioner. You'll feel a heaviness in their energy field. And again, back to go back to the opposite of Zheng Qi, of heavenly Qi. What is heavenly Qi's characteristics? Their heavenly Qi is light, is happy, is bright, slightly warm. You have even thermal regulation all around your body. And there's a lightness and a happiness to it. So anyway, the definition of Gu is a difficult or recalcitrant condition due to hidden and stealth pathogenic infections, including chronic parasites, spirochete infections, fungal and bacterial infections, and environmental toxins that can lead to chronic systemic inflammatory conditions. wow, this would be, again, a whole separate course. This could include cancers, autoimmune disease, Lyme disease, long COVID, Epstein-Barr, mononucleosis, chronic fatigue, basically a lot of the strange diseases that we're seeing today in our world. Okay, let me see what questions I have. So one question is, what is your usual protocol when combining more than one formula and dosage? Okay. That's a great question. This is when first when if you are not an evergreen or you're not familiar with evergreen, make sure you receive the text or the CD, and every formula would have Dr. Chen would have to combine this other formula to this formula for a particular situation. But I have found clinically that because, again, of the purity, potency, and authenticity of the evergreen herbal formulas, one can combine, like I said, sometimes up to 10, which I've never learned that in acupuncture school. And it works amazing if appropriate, without almost no side effects, addressing root and branch and everything else. But when there are more formulas, of course, I reduce the dosing of each of the herbs. Sometimes I keep one formula higher than the other if that's the formula for the chief complaint. Or if I find that if someone comes in with a chief complaint, I'll try to find the root cause of that chief complaint and make that collection formula the primary formula. Dosing wise, I would say if I'm combining, for example, between 2 and 6 collection formulas, I would say average each formula would be 3 capsules twice a day for each. 1 capsule is 50 milligrams. That would give a nice comprehensive across the board effect of all the herbs. I hope that answers that question. Let me see the next question. There are a lot of people out there with goose syndrome taking CBD. No wonder why many do not see results. That is wonderful. And that's what I would say I've had to learn the hard way. But luckily, my patients, when they know that you are intentionally devoted to their care, they trust you and they're loyal. Most of my patients have been coming to see me for 10, 15, 20 years. And, we're not perfect. And yet I remind my patients that as we zigzag sometimes through finding the best herbal formulations, we're taking, sometimes 2 steps forward, 1 step back, especially for goose syndrome, which is very complex. But that question is correct. So many goose syndromes. And I would recommend, going over one of Dr. Chen's classes on the detox formulas. So Dr. Chen, an evergreen, has formulated a handful of collection formulas that detox the major organs. So one is liver detox, GI detox, kidney detox, herbal detox. I believe those are the detox formulas. So usually when you find, for example, that the CBD works in the opposite direction, it's a sign that the body probably is in goose syndrome, meaning possession. So you would take the patient off of CBD and help them go through a detox. And that can be tricky sometimes too, because you don't want to detox too much. You want to detox just enough so they won't crash. But that's when I tell my patients, stay in touch with me, because I will have to adjust the dose, because I'll tell them sometimes too much of a good medicine is not good either. Even though some are so gung-ho and wanting to get better. So I remind them 2 steps forward, 1 step back, especially for chronic diseases and goose syndrome. I hope that answers that question. So the next question. So I was referred by the neurologist for dysautonomia. Acupuncture has been somewhat effective, but I'm hoping for more. Right. So this question, again, I would emphasize herbal treatments. So again, I remind my patients that herbs really help the body shift the internal biochemistry of the body. So acupuncture and herbs, 1 + 1 = 3. But anyway, I'll go. I better get going. Let's begin with the first evergreen collection formula. Is calm. Calm is a enhancement to Jiaowei Shaoyao-san. Jiaowei Shaoyao-san is a modification of Shaoyao-san. And so you could say this is a very strong Jiaowei Shaoyao-san. Clinical applications is stress, anxiety, nervousness, restlessness. General symptoms, poor appetite, headache, tension, insomnia, PMS, irritability, mood swings. Western therapeutic actions, mild sedative effect to relieve nervousness and irritability. It has an anxiolytic function to relieve stress and anxiety. analgesic action to relieve pain, headache, muscle tension associated with stress. So again, this is in some ways Herbal 101. The most common formula all of us were taught in clinic was Xiaoyao San. I remember sometimes if an intern did not know what to do, they'll prescribe Xiaoyao San. And sometimes that is the best go-to if you're not sure. And I remember a colleague who's treating so many patients in community acupuncture. He would tell me sometimes things get so busy there, he'll just do 4 gates. So again, back to the basics. We want qi to move, and if qi doesn't move, we have stagnation. And if we have stagnation, we have more problems, much more problems. Okay, so the TCM therapeutic actions of calm is to spread the liver qi, nourish the liver blood, clears heat, and harmonizes the middle jiao. I'm going to skip all the ingredients and kind of focus in on a few because of time. And that you could review on your own. Basically, what I shared is calm is a modified or enhanced Jiao Wei Xiaoyao San plus Zhichi and Mudan Pi. They're all in proprietary proportions. They have stronger tonifying and anti-inflammatory functions. Zhichi is bitter cold, clears heat in all jiaos, relieves toxicity, cools the blood, invigorates blood, reduce swelling. We have Mudan Pi, sorry for that grammatical error, acrid, bitter, cool, clearing deficient heat, invigorating the blood, clear heat, drain pus, and reduce swelling. So those 2 herbs were added. And as I've mentioned before, we are living on a planet that is warmer, and it's going to get warmer, and we're just seeing more and more inflammatory cases just all over. So the foresight of Dr. Chen in seeing this is wonderful. Both herbs clearing heat and clearing deficient heat and invigorating qi and blood. So again, we don't want to stay on this formula for too long. So we can combine with qi tonics and may cause qi deficiency. So again, that I could say we'll just have to use our clinical expertise in assessing our patients' qi levels. So one contraindication of calm is do not use if the patient is on an anticoagulant or antiplatelet therapy like Coumadin or heparin, those drugs. I have found it to be okay with pregnancy and nursing at lower doses. So half the recommended doses at least for liver qi stagnation symptoms. Sometimes I have found for patients in this category of calm is an addition of a vitamin B12 shot Unfortunately, in California, we cannot give shots, but I know some states can. Vitamin B12 shot and magnesium can help, and try to avoid stimulating drinks like coffee, alcohol, energy drinks. So this is straight from the Dr. Chen's textbook on, I'm sorry, we're going right into Calm ES. So let me see what questions I have. Do I teach bloodletting through eLotus? Oh, yeah, I answered that. I have not yet. Where do you practice? And very interested in COVID formats. Oh, yeah, we will get to that. The question is where I practice. I practice in North Berkeley, California. My clinic is in a beautiful part on the hills of Berkeley, and we, in some ways, can see the beautiful University of California, Berkeley campus, a beautiful part of Northern California. Lots of trees outside my office. I love it. What was the other question? So the next question is very interested in COVID formulas. Will you talk about that here? Yes. So do not go away. That's the second half of my class. I'm going to give you wonderful tidbits on COVID and long COVID at the second half of this class. And I can say that all the COVID and long COVID patients that we have treated in our clinic and all over the world have all survived. And are all getting better. So that will come the second half. Yeah. Okay, the next formula, collection formula, is, I consider it an amazing, ingenious formula. Calm ES, clinical applications, stress with poor appetite, headaches, tension, insomnia, similar stress response. ES stands for extra strength. Extreme or severe emotional and psychological disorders, such as hysteria, neurosis, schizophrenia, withdrawal symptoms associated with alcohol, drug, and smoking addiction, insomnia with disturbed sleep and night awakenings, Western therapeutic actions, sedative effect to relieve nervousness and irritability, anxiolytic function to relieve stress, anxiety, tranquilizing effect to alleviate severe emotional psychological disorders, calming effect to ease withdrawal signs and symptoms associated with drug, alcohol addiction, antispasmodic to relieve muscle tension and cramping. Wow, that's a lot. I've been using this formula a lot these last 3 years. So TCM therapeutic actions, spreads liver qi, purges excess liver fire, calms the Shen, and tranquilizes the heart. So this is some of my clinical wisdom that I'll share with you. This formula, whenever I say it's the go-to formula, that means it's a very special formula. I always use this formula for patients struggling for any type of addiction, withdrawal, or psychiatric disorder. This could be from pharmaceutical addictions like fentanyl and Percocet, from street drugs to alcohol to food addictions, any kind of addiction. Amazing formula, and it helps my patients even in their sobriety to stay sober throughout, and that's very critical. It's another formula that I use for nightmares and waking up in the liver gallbladder times, like 11 p.m. between, 11 p.m. to like 2 a.m., 3 a.m. In that time, we know from the circadian TCM clock, when anyone kind of wakes up at that time, we go for the wood element. And many of my patients have been struggling with waking up at that times or having anxiety, nightmares, panic attacks. So sometimes when it's severe, I'll tell a patient, okay, take 1 to 3 capsules when you wake up, Calm ES. And this formula works almost immediately. There was one herb in this formula that I just remembered now that I haven't put it in the PowerPoint. It has valerian in it. And I've had a couple patients at least 2 patients that have some allergic reaction to valerian. So that's another sign that I have found of potential goose syndrome, where the liver, gallbladder, the wood element needs to go through some detoxification. So again, if someone has an allergic reaction to this formula, for example, causing more anxiety, like the CBD, you would not use this formula temporarily until somehow you can address the goose syndrome or find an alternative formula. So there are 2 significant herbs in this formula, as you remember, the famous longu and muli, which anchors the Shen. These are 2 beautiful herbs. Sometimes those 2 herbs, as you know, because they're shell and stone, can be sensitive to people's stomach. So I will recommend taking this formula maybe after they eat so that those 2 herbs won't irritate their stomach, but that's very rare. Excellent acupuncture points to use. I use a lot of ghost points from Sun Sumyao, the medicine Buddha, and the Nada Ear protocol. So again, as I mentioned, patients with weak digestive system may cause some irritation or diarrhea. Caution, but not contraindicated for anticoagulant and antiplatelet therapies like Coumadin and heparin. Contraindicated in pregnancy and nursing because moves qi and blood. I usually also advise patients to adjust their sleep so that they'll sleep before 10 p.m., before the liver gallbladder time, get regular exercise. That's another lifestyle change one can make to help clear cortisol, help move qi and blood. Some warm Epsom salt baths to help detox the blood through the skin and calm the shen. And usually I'll have a network of psychotherapists and counselors that I can refer my clients to. So I tell them that larger support system they have, the better they'll be. I never want to be the only practitioner, supporting them. So the wider net of help, especially those taking Calm ES that they can have, the better. Okay, let's see what questions I have. Okay. Okay, how do I utilize these formulas in conditions when there is, let's see, when it causes cramping and loose stools? So the question is, what do I do in the formulas when there is cramping and loose stools? So again, loose stools would be usually a symptom of spleen qi deficiency. So it depends, from your assessment. The evergreen formulas have an amazing collection formula called GI tonic to tonify the spleen, and I believe it's a modified Shenling Baiju San, an NCCAOM in California license exam formula, but an enhanced formula for loose stools. Or if there is cramping, I would combine like the Calm or Calm ES with another evergreen formula called Flex SC. So SC, I believe, stands for strain and cramping. And that's strain and cramping is usually due to a deficiency of yin and some kind of qi stagnation. Cramping, I notice, is common in those with diabetes, more common in the geriatric population. You can combine Calm or Calm ES with either of those formula, or if they don't want to take another formula, you could prescribe and teach them how to make kanji, which is a wonderful spleen tonic in Chinese medicine, where rice is boiled, with particular vegetables or some meat, boiled for a long time. So kanji, but you can look that up online. Yeah, wonderful recipe for tonifying the spleen and enhancing yin and fluids in the body to prevent cramps. I hope that answered that question. let's see. Oh, I have 30 minutes before our break. And I promise I will try to get through all this as quickly and efficiently as possible. So the third calm formula is calm ZZZ. So this is a formula for patients with underlying deficiency who suffer from chronic and constant stress, irritability, anxiety, and emotional instability. It's insomnia due to difficulty falling asleep or staying asleep in patients who are stressed or have things on their minds. Type A personality with excessive competitive drive, impatience, sense of urgency without the body, strength, and constitution to cope with stress. So, as you know, I live in almost the capital of close to Silicon Valley and San Francisco, a lot of computer programmers, a lot of people on the go, very ambitious, professors from the university, ambitious with a competitive drive, kind of a, type A personality, but they go, 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 and they run on reserve energy. And one telling sign of this formula, which I will talk a little more later, is asking your patients, when you wake up in the morning, do you feel rested? Do you feel ready to go? If your patients say they don't, and they even get 10 or 12 hours of sleep and they still wake up unrested, then you want to kind of eye in on this formula because you know that there is an underlying deficiency at the root. So Western therapeutic actions, anxiolytic effect to relieve stress and anxiety, sedative and hypnotic effect to treat insomnia, muscle relaxant effects to alleviate tension and stiffness. This would include temporal mandibular at the jaw, people who grind their teeth at night, oftentimes unconscious. So remember, this is one of the questions on your quiz. This formula of all the collection formulas has the most calm Shen or calm spirit herbs in its formulation. And that's what I really love about this formula. I think it has at least 5 or 6. A beautiful formula. Regulates qi, sedates liver fire, and tonifies deficiency. So here, these are some of my clinical guidance. It's a go-to formula for someone who is exhausted with liver qi stagnation. And again, we've been seeing this much, much more these last 3 years. People are functioning on reserve energy and exhausting their well of qi. And, that's just a spell for disaster. And some of it is just a physiological addiction. And that's where you can combine calm ZZZ with calm ES as well. It's a go-to formula when unable to fall asleep and unable to stay asleep. So again, as I mentioned before, we need qi to sleep well. When the well is empty, one cannot fall asleep and stay asleep at the same time. So second quiz question and answer. This is the go-to formula, the base formula when a patient tells you, I cannot fall asleep nor stay asleep, both at the same time. So this formula has the most calm Shen herbs in it. It treats both excess and deficiency of Shen disturbance. So caution may cause drowsiness, especially those who are sensitive. And again, because this is the formula that has the most calm Shen herbs in it. Do not take with alcohol or sleeping pills like lorazepam. And some of your patients may tell you that they have an allergy or intolerance to gluten or wheat, or have celiac disease. This formula has xiaomai, which is the gluten-based herb. So you want to not prescribe this for that condition. So the summary of the stress psychological sleep collection formulas, again, we covered was calm, calm ES and calm ZZZ. Calm is for mild to moderate stress and anxiety. Calm ES is moderate to severe anxiety and stress. And calm ZZZ is exhaustion with chronic stress, anxiety, and depression. And I add the word depression is added in here because from a psychological standpoint, when someone is so exhausted, running on reserve, anxiety and depression is like two sides of a coin. You'll see both. And we will cover depression more in detail after this. Let's see. Let's see for any questions. So would calm ZZZ be appropriate for someone already taking sleeping medications like Ambien? So usually what I will recommend if someone is taking a sleeping drug like Ambien, but first you want to ask your patient what are their desires, what are their goals with Ambien. For example, a patient might say, I just want to stay on Ambien because it works. But in your scope of practice, as an acupuncturist, you can download the long-term side effects from a Western pharmacological perspective to your patient. You can give them a copy, educate them on some of the side effects of Ambien. And I would say some of its side effects is toxicity in the liver and the kidneys. and also they know that sometimes ambient you are unable to drive, or you have to be very careful because it's such a strong tranquilizer. Some patients might tell you, can I, if the Ambien is prescribed by the physician as a PRN or as needed, you could give them guidance and say, okay, one night you could do Calm ZZZ for the insomnia and stress, and the other night you could do Ambien. And as the Calm ZZZ begins to take over in the body, they may notice that they may not need Ambien. So that's one strategy you could offer that patient. Third scenario, if the patient asks if he or she can, if the doctor has given them a range of dosing for the Ambien, which you would need the doctor's guidance on this and check in with the patient. The patient could do a lower dose of Ambien and take the Calm ZZZ at least about 2 to 3 hours apart. And I would put a positive spin to that with your patient to say that you want the herbs to work at the optimum when it's separate from the Ambien, at least 2 to 3 hours. So those are three scenarios that I can think of, depending on the patient's goals for this. But likely most of the patients that come to us want to move to a more natural form of intervention with sleep anxiety and depression, because they know either the side effects of the drug or the long-term toxicity. And the practitioner should know that as well. And that's how we educate ourselves on drugs. Okay. More questions? Okay, next formula, I will do my best to get a little quicker, is depression. So 2 formulas in the Evergreen collection is Shine, depression with low energy and sadness due to chronic stagnation, and Shine DS, liver qi stagnation with heart fire, where depression is more than anxiety. So when I share this, I'll share later more that I would try not to use Shine DS and Calm because they're very similar. So if Calm, for example, where there's more anxiety than depression, use Calm. If there's more depression or anxiety, use Shine DS. But I'll talk about that more. So TCM definition of depression: prolonged stagnation of qi, blood, dampness, and or food. the traditional protocol to address depression in TCM is to break up stagnation, nourish internal organs together. So just some recent longitudinal studies have shown that depression can shorten a person's life by 10 or more years and is a risk factor for coronary artery disease or CAD. So again, we see the mind-body connection of disease, how the psychological state of one can affect the physical state of one's health. So we'll go to the current Western psychiatric definition of depression. So these are the symptoms in the Diagnostic Statistical Manual 5. So depressed mood almost daily, loss of interest and pleasure in almost all activities, significant weight loss or weight gain without dieting, insomnia or hypersomnia almost daily, fatigue daily, feeling worthless or guilty almost daily, poor concentration and indecisiveness, and recurrent thoughts of death or suicide. So the diagnosis of major depression is at least 5 of these symptoms within 2 weeks, and a diagnosis of persistent depressive disorder at least 2 within 1 year. So we'll go to the first collection formula called SHINE, clinical applications, depression, depression with low energy, prolonged sadness or irritability, and lack of desire for daily activities, Western therapeutic actions, antidepressant effect to elevate mood and energy, promotes digestion and utilization of energy. TCM therapeutic actions relieve food, qi, blood, and phlegm stagnation. I like to add heat stagnation as well. Promotes movement of qi and releases constraint. So this is my interpretation and some of the guiding principles for this formula. This is actually a modified and enhanced Yuan, which is an NCCAOM and California license exam formula, which stands for Relieve 5 Stagnations. Remember that for the quiz. So relieves food, qi, blood, phlegm, heat, stagnation. This formula is ingenious in that Dr. Chen replaced Kang Shu with Shichang Pu. Shichang Pu, as you know, is a powerful herb to open the orifices and resolve phlegm. Additions to the Yue Juan is Chai, which is green tea to lift mood. Chai Hu, lifted Qi, Dat Sao to nourish heart blood, Longu and Muli to anchor Shen, the same 2 in the Calm ES, Yuanzhi, He1P, and Shichang Pu, all 3 are Calm Shen herbs, and Shichang Pu also opens orifice, Yujin assists Chuan Shang to move blood and clear blood stasis. And one interesting herb that Dr. Chen included in this formulation is a Western herb called St. John's wort. In its it's used in its ability to enhance the strength of the entire formula. But I'll discuss the pros and cons of having St. John's wort in this formula. Okay, so one of my clinical experiences using Shine is that it is a go-to formula with another collection formula called Herbalite. Herbalite is made for those who want to lose weight that has spleen qi deficiency, and I combine it with an adaptogen, the 5 that we discussed earlier for weight loss sobriety. So I have found from clinical experience that those who struggle with weight also struggle with some form of depression. And as one goes through a weight loss regimen, the person faces much of depression that they may not have addressed previously. And so some of my patients would tell me, "Oh my God, we're having to face our demons from the past." And again, referral to a psychologist or a professional in that area can help. And again, as I shared, we add the adaptogen because cortisol is stored in adipose tissue. So as we clear the adipose tissue, we're going to have to face clearing out cortisol, which can be a difficult journey for those wanting to lose weight. It's so common for one to go on a weight loss diet and revert right back, and then go back on a weight loss and revert back. So I have tried to help my patients stay as best as they can on this path of sobriety. And Shine is an amazing formula to help them with Herbalite and an adaptogen herb to stay on this path of sobriety. So contraindication is pregnancy and nursing, also celiac disease, gluten wheat allergies because of Shen Chu in the formula. One challenge of this formula is that St. John's wort, has quite a number of interactions with other drugs, all SSRIs, Coumadin, theophylline, HIG drugs, and some migraine combinations and combined oral contraceptives. And what Dr. Chen recommended is if one did discontinue these drugs, wait at least 2 weeks before starting Shine. So anyway, some of you might have a question. This is an amazingly powerful formula for depression, but if you are faced with someone, doing some of these drugs, what do you do? So I would usually go back to Yue Juan, which does not have St. John's wort. It's not as powerful as Shine. and it does not so will not have interaction with these drugs. And then I would combine Yuejuan with other formulas if needed. So again, I always help my patients with lifestyle as well. I tell them, you need to work with me. You need to walk with me on this path. I cannot constantly pick you up on my own. So if you want to help me and help you, we need to look at your diet and lifestyle. So, basic, we'll go for more high fiber, fresh fruits and vegetables. Try to avoid processed and artificially sweetened and fast foods. Exercise regularly, at least 20 minutes a day. Get at least 8 hours of sleep daily. And socialize with friends who love you unconditionally. And when you share that, make sure that you do this yourself too. So you want to walk the talk with your patients so that they can look at you and know that you are also following what you're advising them to. And what I have noticed is that those who are depressed tend to somehow attract friends or loved ones that tend to be depressed or negative too. Friends that tend to look at life half full, half empty, rather than half full. So I just try to encourage them, try to be around friends that look and see their life as half full. There is always something to be grateful for. And those who are really, really depressed for whatever circumstances, I'll tell them just wake up in the morning and just write down one thing that you are grateful for today. Yeah. Okay, the next collection formula is Shine DS. Again, this is an ingenious formula created by Dr. Chen. He created this formula. I haven't asked him directly, but I believe he created this formula as to make sure that there is a depression formula that does not interact with any drugs, any antidepressant drugs or other drugs. So if your patient is on a psychoactive or psychological drug, this is the go-to formula to go. So clinical applications: depression, stress, anxiety, stress, irritability, sadness, lack of interest, possible chest distension, abdominal bloating, generalized weakness, and discomfort. So Western therapeutic actions: antidepressant effect to elevate mood and lift depression, anxiolytic effect to alleviate stress and anxiety, GI effect to regulate and restore normal digestive systems to improve energy. And as you remember from TCM Theory 101, liver has a tendency to attack the stomach and spleen, attack the earth element. It's the most common way that the wood element goes when it's not happy. So TCM therapeutic action spreads liver qi and clears heart fire. So when we're finished with this formula, we'll take a break, but please stay with me, okay? Just a few more minutes. So I'll let you look at this on your own So basically, I want to give you the summary of this formula. Its formulation is actually a modified calm that we learned prior, but it does not have boha, the mint, and shengjiang, which is the ginger. But added to it, it has kangshu, clear damp stagnation, chuan sheng, clear blood stagnation, shen chu, clear food stagnation, xiang fu, clear qi stagnation. Let me see. And it has yuanzhi and hewan pi to calm the shen, and zhimu to nourish yin and clear deficient heat. And it's basically a go-to formula, as I mentioned earlier, if depression is greater than anxiety. So again, if anxiety is more than depression, go to calm. If depression is more than anxiety, go to shine DS. But you'll notice in this formula that similar to Yue Juan, clear 5 stagnations, Dr. Chen has added herbs to this formula to clear the stagnations. And basically, that's the root of depression. There is stagnations systemically. So this formula has the ability to spread liver qi and clear heart heat. I would say more than shine, and created to use safely with any antidepressant drugs. As far as Dr. Chen knows, there are no known interactions with drugs. Contraindicated for pregnancy and nursing, contraindicated for celiac disease or allergy to wheat gluten because of Shen Chu. Caution with anticoagulant and antiplatelet drugs. That means you can take this formula with these drugs, but be cautious. Make sure this formula is taken at least 2 to 3 hours apart from it and at a lower dose. So example, if you if we usually dose this at 4 or 5 twice a day, we'll go to 2 twice a day, but we'll have to stay in touch with the patient to make sure that there's no, unusual type of bleeding. Okay, let's take a break. Let's take a 15-minute break. Thank you so much for staying with me for these 2 hours. So get some food and some water, and I'll see you back in 15 minutes. Yeah, I'm gonna sign off.
Okay, thank you, Dr. Mura. See you about 15 minutes.
Thank you.
Recording stopped.